Good morning. I'm Nicol Clayton, the Barth Syndrome Dietician from Bristol, and thank you to the Barth Syndrome Foundation to ask me to talk today about vitamins and minerals. Just to recap, vitamins are called because they're vital for life, and there are 13 vitamins, and we broadly split them into two groups. So the first group are the ones that dissolve in water, and that's important to know because that means you lose them more frequently and you'd have to take them in more frequently. The second group are the fat-soluble vitamins, and again, the reason that's important for you to know is that we don't need them every day. We have stores of them, and if you take in too many, then they can become toxic. There are 15 dietary minerals, and again, they're split into two groups. So the big minerals, they're used for bone health, calcium, phosphorus, magnesium. And then there are the trace minerals that you need in smaller quantities, such as iron, zinc, copper, and selenium. And high doses of any of these can build up and cause problems. So thank you all for those who returned the nutrition survey. Vitamin and mineral supplementation is really common in Barth syndrome. In fact, it's close to 100% in the young boys. And it starts to drop off as they get older, but still, of all of us, 72% of them take a vitamin and mineral supplementation. Most of them tend to take an age-specific one, but some are taking individual ones, vitamin D, zinc, and calcium, and a small few are taking what would be more mitochondrial-targeted supplements, such as L-carnitine and CoQ. Just under half of you taking a vitamin are not monitored. So it's fair to say that it's hugely profitable. I went into Walmart and it's stretched from here to here, the amount of vitamins and minerals and promise of wonderful energy that you could have. And in the UK, over half of households, their children give them a multivitamin and mineral. And the reports are it's over £20 billion a year spent in America on vitamins and minerals. There is a belief in the positive power of them. If I had £1 or $1, about the same thing at the moment, for someone who said to me, you really should take some vitamin C for that cold, I would be able to afford one of those really big beds on the beach. And just for a day, maybe half. In fact, there is no evidence that having mega doses of vitamin C help to prevent colds. 16 studies have shown this not to be true, but still, it's something that we all think, well, it can't hurt. And then in the early 90s, there was a belief that if fruit and vegetables give you lots of protection against cancer and heart disease, then it would be really good if I could just take those vitamins out of those fruit and vegetables and have it as a daily pill, and I'll get all those benefits. But in fact, at best, there's no effect by taking these. And at worst, it can increase the incidence of cancer and heart disease. And a recent review, the Cochrane review, is where they gather all the studies together, and they looked at 78 trials and found no evidence to support the need for most people of having a vitamin containing A, C, and E. And now things are swinging the other way, although I think people are still buying these. There's enough evidence to say, stop taking them. If you don't need them, stop taking them. And this was published in 2013. Particularly for the general population, there's no clear evidence of any benefit. But some groups do need supplementing. So ones with a known deficiency, that goes without saying. Any chronic illness that increases your requirements or increases losses, such as ulcerative colitis, Crohn's disease. There's also specific advice for smokers, pregnancy and breastfeeding. And in the UK, all children up to 5 years are recommended to take a small dose of these vitamins. So what are the risk factors in Barth syndrome? Well, smaller portions, few foods. I mean, the survey was very clear that the majority are very choosy in what they eat. So they're eating not a fully balanced diet, so there's always the worry that they're not getting everything that they need to. The boys spend more time indoors, so they're at a higher risk of vitamin D deficiency because that's made primarily under your skin from the sun, and in the UK, that's not often there. We know that the boys from Todd's work have a higher rate of glucose turnover and possibly protein turnover to make glucose. So do they need more B vitamins than normal? However, because the boys are metabolically fragile, they're also at risk of oversupplementation. So these are our findings from the UK clinic. So every time the boys come to clinic, which is between 6 months to annually, I test them to see what their vitamin levels are. And I don't test all of them, but I test the main ones that are easily detectable in the blood. So as you can see, I've circled the main findings. In terms of a deficiency, the things the boys are at highest risk of is a vitamin D deficiency. And I think that may well be UK specific, and it would be interesting to see whether that's different in America. I know Donna was saying actually in Australia, even though you think that's really sunny, because they're using lots of sun cream, there is a rising increase in vitamin D deficiency. And so a lot of the boys need separate vitamin D supplementation. More of the surprising findings are the ones where you wouldn't expect. So half of the boys have got levels of vitamin A, which is the vitamin that's primarily used in terms of vision and growth and development. When you test their blood results, they half look like they're deficient in vitamin A, and then the natural thing to do is to give them another supplement. So that's what I did, and then they didn't respond. So we looked further into why they're so low in vitamin A, and it appears that they're just not carrying vitamin A in their blood around in the same way, so we don't detect it on that blood test. So they're carrying vitamin A around in a different way. So it's still there, it's still available to their tissues. There's no issues with their eyes. More work's needed for that. And I had some really interesting conversations last night with some great scientists about where is that vitamin A? Why is it being carried in a different way? So I hope to do more work on that. The message is, though, if you do have a test and they come back and say you're deficient in vitamin A, please ask for a retest after supplementation, because it may be that you're not and you're just adding more and more vitamins into your diet. You're not truly deficient. Unsurprisingly, a lot of the boys were low in vitamin D, and a couple of the boys had low ferritin, which is low iron stores, because red meat, good sources of iron, are quite difficult to eat. Then we came to the high levels, and really surprisingly, the boys were high in B6, high in B12, and high in selenium. And I looked at this and thought, we're giving them too many, that's why. Because selenium's not normally high in the UK. We don't have good sources of selenium in our diet. Perhaps we're over-supplementing, but we're not giving any of the boys high-dose B vitamins. They're just having a general low-level multivitamin and mineral. And again, I was speaking to some of the scientists last night, and they were saying perhaps the boys aren't taking too much in, but they're just not able, their cells aren't able to take that up. So that's something that I've got some names. I can now look into this in more detail. If anyone's got any good ideas, please see me afterwards. So, current lessons. If you are taking a supplement, give an age-appropriate, low-level multivitamin and mineral. So one that's got everything in, but for us in the UK, it's important that they have a good dose of vitamin D. You may need additional calcium, magnesium, because these multivitamins don't have much of that in if you're not having any dairy. But if you are having a good cheese, milk, yogurt intake, then that will be fine. Additional B vitamins may be helpful, and I know lots of the boys are on quite big doses of B vitamins, but my research shows that the levels are building up. They're not toxic, but they may not be using them in the way that we think. We don't have at the moment any evidence for supplementation with carnitine and the mitochondrial type of supplements, but I don't have any evidence that they're causing any harm either. I think carnitine, Dr. Kelly said that carnitine was fine providing there is a deficiency, but there's no benefit in giving it on top of what's already there. If possible, obtain a prescribed product. Take into account all sources of supplementation. So bear in mind, if you have a cereal with vitamins and minerals in, that's a good dose. I went to the supermarket and everything's fortified. So lots of vitamins and minerals are going into your everyday foods already. And obviously, if you're on any tube feeds or nutritional drinks, take that into account. Check the ingredients. Some of the multivitamin and minerals have some unusual ingredients. So just make sure you know everything that you're taking. And each country has its own seal of approval, but that doesn't mean that that vitamin and mineral has been tested if you've bought it over the counter. So there's many stories of children, or adults in fact, taking a vitamin and mineral that they've bought and it having either none of the prescribed product or none of the intended product, or 5 times the amount of the intended product. So I think if you're taking something regularly, then it would be important to have your blood levels monitored, just so you know that you're not overdosing or underdosing. Common sense on megadoses. So your body's an incredible thing. So if you needed to take in all the vitamins that you would get, this is vitamin C, you'd need to eat 8 melons, or this many peppers, or drink 2 litres of orange juice to get this 1,000 milligrams of vitamin C. That doesn't seem physiological. That doesn't seem right. So it's just, you're sensible people. It's just to know if you're taking a mega dose, would you be able to eat that amount of food? Is that really what your body needs? This is a great site. Dietitians of Canada have put together some information on how to choose a multivitamin, and they've got all the ages there. There's the website. If you wanted to note that down, these slides will be on the Barth Syndrome website. And this was a really good production by NHS UK, going through not just vitamins and minerals, but other things like omega-3s, just to really understand, do you need to take them? What's the evidence behind them? Thank you. Any questions?
I was just wondering, when it says age-appropriate level, so is that their real age or their bone age?
That's a fantastic question. It's their real age for vitamins and minerals. It's debated often whether you use their height age, so whether you go for it if they're the size of a 4-year-old, you pick the requirements for a 4-year-old, or go for their normal age. At the moment in the UK, we say for vitamins and minerals, go for the recommended amount for your chronological age. Any other questions? Okay, thank you.